tamoxifen study claims that a combo of chemotherapy and hormone therapy tamoxifen is more effective than tamoxifen alone in preventing breast cancer. In the study, a group of researchers from the United States and Canada studied 1477 post-menopausal women with early-stage breast cancer. The women were randomly assigned to one of three groups. So Group A received tamoxifen alone for 5 years. Group B received chemo and tamoxifen for 6 months, then 5 years of tamoxifen. Group C, chemo alone, followed by 5 years of tamoxifen. All 1477 patients knew which treatment they were receiving. The study can best be described as, is it observational? No, both these observational answers are no way. Observational, what's an observational study? Observational is when no treatment is given, when no treatment is given to one group, how about I do it this way? How about I say what an experiment is? That'd be easier. An experiment is when you have a control group and a treatment group. The control group, they get no treatment. Right? That's why they're there. They get no treatment. So you're comparing. An experiment is when you compare two groups, at least two, maybe more. One of the groups has got to be a control group, meaning they're not getting the treatment. So you can compare them and the results of to the group that is getting the treatment. Observational study, there's no control group. You're just observing what happens, but there's not a control group. There's not a group who gets nothing that you can compare to. No control group. An experiment. So this is an experiment using a control group. That's our answer. Why isn't it an experiment using a placebo? No, there's no placebo. There's not a placebo in this problem. Remember what a placebo is? A placebo is a fake treatment, like a sugar pill. When somebody thinks they got a treatment, you tell them they got the treatment, they got the drug, they got the whatever, and they didn't really. That didn't happen here because all the patients knew. So there was nobody being faked out. That's what a placebo is, where you give them a fake treatment just to see if their mind is actually doing the healing rather than the drug. These are all ways in which we determine if a drug or a treatment is really effective, or if it's just mental, or if it's not doing anything. So this is an experiment with a control group, but not a placebo group. The control group, by the way, is Group A, because they got tamoxifen alone. They didn't get the chemo. Remember, the question was a combo of chemo and tamoxifen is better. So this group is the control group because they didn't get the combo. See, the others got the combo, chemo and tamoxifen, chemo and tamoxifen. The others got the combos. They're the treatment groups. A did not get the combo, so that's the control group. They just got the tamoxifen. So there is a control group. This is an experiment.